today. We will look inside the current status of the M-pox sick in the country and how to prevent them. And for talk more on that, make we get the operation lead for the M-pox response at the National Public Health Agency, Dr. Mustapha Jalloh. We can give updates and the things that we don't put in place for prevent the M-pox sick, not for spread pass how it on the spread. So, good morning, Doc, and welcome to the program.
Thank you very much. Good morning, everyone, viewers and listeners. Me, Dr. Mustapha Jalloh, currently the operation lead for the National Public Health for the M-pox response in Sierra Leone.
Today we look at the current status of M-pox and how they go able for preventer. Where with that, we get Dr. Mustapha Jalloh, when the operations lead response na the national M-pox response na the National Public Health Agency. We will tell we about the status of M-pox na salon. Where with that, I want to forgive the National Public Health Agency na body way government be set up for prevent, detect and respond to public health issue them and salon. Inside Salon January 10, they record the first case of M-pox, and January 16 this year, the Ministry of Health been declared public health emergency on the M-pox sick. Well, with that, I want to welcome Dr. Mustapha Jalloh again. Good morning and welcome to the program. Good morning, Salon.
Yeah, thank you very much. I think.
Okay, so Dr. Jalloh, before we can look at the current status of the M-pox sickness salon, first tell people again waiting at M-pox.
Yeah, so I think we colleagues them done there before, and if you check, a lot has been said about M-pox. M-pox now sick. We've been on there around for long, since the early 70s. We initially been transferred from animal to human. And now we see more of human-to-human transmission. This is not a viral disease where it affects human then, and you get different type. We get one way they call different clade 1 and clade 2. The clade 1 then at the central region of Africa, then Congo and other countries that then surround them. And it gets subtype when type A, 1A and B, and we get the other type when clade 2 where now they know for West Africa, in the current West African clade, where now we get na Sierra Leone, Liberia, Nigeria, and other countries in the West African Ghana as well. So M-pox actually the type 1, well, now they say literature or evidence don't you say more virulent, meaning it can cause more severe form of the disease, and the clade 2B, the clade 2 where now the West African clade, well, then say a mild compared to the clade 1B. But we all know some of them virus there they can, mutate. So severity depends again on the person where the virus, the way they get the virus, in immune status and generally in health status. So dynamic we see currently in our country.
Okay, so with the kind different images we don't see on M-pox na social media. So which type of M-pox we get na salon?
Well, when the outbreaks are just like I say, we get our first case on the 10th of January this year. We continue for record up to 20 cases. What do we do as a country? We take some samples them for sequencing. We send them na Dakar, and the sequencing result tell us say na clade 2B. Now we get but that was the initial part of the outbreak. We take some samples and send na clade 2B we get, but we don't ship another sample along the line for see if yes the first result consistent with what we don't send now, what they happen now.
Okay. So now let's look at again, waiting at some of the signs and symptoms of M-pox na salon.
Yes, so first of all, fever, fatigue, you get that tired body, the body the warm, and most prominently the rash. The rash within the way is very unique to M-pox. It can start most time at the face. But now you see they can come on other parts of the body, your genital area, and also it gets your lymph node in the swell, either in your neck or between your legs, under your armpit, which is one of the unique signs and then of the M-pox. And also, if you look at the rash again, the way they spread now, some people they see on them palm, or the sole of them foot, So those are the ones that actually we see as signs what we see currently in Sierra Leone.
Okay, you just give the signs of the M-pox sick. How somebody can detect, say, this na M-pox sick or na M-pox sick this person don't get? How somebody can for determine that?
Yes. So as an individual, you will not to medical person, and the only way we they confirm say you get M-pox now through laboratory confirmation. You get what you call suspected case. Once you don't present with them signs there, we require for we want to make you go to the nearest health facility. We get the well-body people and go look at you and see whether you meet what you call case definition. If you meet that case definition of M-pox, immediately they will collect the sample and send them for test and confirm them. But we not just look you say okay, this is not M-pox and confirm. But you not suspected until the lab results tell we.
Okay, make I take you back at initially we be the key update about waiting at M-pox. You say initially we Salon record the first case. We be get the article 2B about that don't shift due to some tests them we wanna do. So then tested they will not do. Waiting at the result, waiting at the current which not type of M-pox now within an Salon.
If you let me say this again, we did the first sequencing. We tell you say na clade 2B,
yeah.
The initial phase. Recently, we don't collect other samples there for sequence them. We are waiting the result for now we see whether it's consistent with the first results we get. For sure, say yes. Now still na clade 2B we deal with.
So this sequence result one of the way to these samples na Salonia na cable for do the examination or na send the sequence out.
They do but for quality, for standard, global standard, you get for sending out labs then for validate what you results we don't get. We just do now global standard, So just the test and say even we test the way they do so. We send them back now other labs then for confirm and validate the results they we don't get. Don't we use one lab no more.
So what's not the reason we make on can send the samples here to go other countries for examination? Is it that the facilities are not there for actually do the test here?
Like I say, we do the testing now, but it get for compare for global standards. We work with other partners in WHO, US CDC, and other international organizations there. We've themselves in very, very interested in the support, some of them things that what they do.
The signs and symptoms we mention are one way not different from other sick them like chickenpox, scabies, and other one there. So how person go able for no say this na M-pox sick you don't get?
Yes. So like I tell you earlier, the rash now one of the signs them we they look at, and also fever, and as basic case definition. So we can tell community people, community health workers, that anybody in your community will get fever or rash, make you go to the nearest health facility. The well-body people them will tell you better, and like I say, they will see you as a suspected case, not a confirmed case. Anybody right now, me and you, anybody who gets rash, because now only the well-body people will able to tell you clearly say this na M-pox or this na chickenpox. But one thing I will say again, chickenpox, they get the rash in your palm them.
Okay.
Yes, the sole of your foot, they see them. So, but for do all and day, now make it go to the well-body people and collect the sample, then go test them. Then they do what they call differential diagnosis, for so say this exactly na M-pox, not to chickenpox.
Okay, so now let's look at again waiting if person don't come in contact with the person who gets the M-pox sick, for how long it take for make the person self go no say they don't get the M-pox sick? like the incubation period?
Yes. So I've been saying like initially it start with fever and body pain. So between that period, you develop a rash. So and it can take like for let you get that rash day, it will take 2 to 4 days for let you develop the rash. Between 2 to 4 days it develop the rash. So once you don't develop the rash, then you can, like I say, go to the nearest report yourself or go to the nearest health facility for let the body people and see you and examine what I mean the case definition.
With the type of M-pox sick where you don't mention, now we don't see how it don't affect people and genital parts them. So which type of M-pox sick than they, or is it that now salon more they get then kind case they are so among the West African country them?
Yes, so the genital lesion not only means this outbreak no more salon unique to. When you read this some of the signs and symptoms, you see genital lesion as one of them, but we still look at them. Every outbreak gets your own characteristics, because depending on the time we occur, depend to the virus, if you're not mutated. So, but we don't see a lot of cases now in our own context with genital lesion. Studies they show say they're around 50% to 60%, and we don't see yes the cases that would get still they're around that, but we still continue for record some of them in there, and as the outbreak they go.
Okay, so you can tell family waiting can be the cause for that.
The genital area are very moist, and it gets a place beside the virus they able proliferate well, and other superimposed infection, bacterial infections them will come in and waiting them. So now make it the final say most time the genital lesion the waiting them. And some people go there with this 1 day, 2 days, you go say 1 week, they go to hospital. Okay. Just they feel say okay, now so sometimes okay. So because they can day for long, they don't go na hospital, they make that thinking lead to genital lesion. The rash they lead to the lesion.
So Dr. Jalloh, you don't talk about M-pox, the signs and symptoms and the transmission process. So now give me an update of the M-pox sickness alone.
Yeah, thank you very much, Kari. First of all, I think that's a very good question, and I've been waiting for letting they come up, because at this time, people need for know waiting at the situation update in country. First of all, from the 10th of January 2025 to yesterday, we went at the 8th, we don't record a total of 1,603 confirmed cases. When I say confirmed cases, we get people when they come forward, we take their sample and test. Then one day we then turn positive. Among them, some can be negative. But generally, like I've been saying earlier, anybody who will see suspect with a tester. So that's not the total confirmed case as of yesterday. Among them, we don't lost 11 people now, and we get 354 we don't fully recover and discharge officially. And again, initially when the outbreak start, we see more man that were affected, but now that gap don't reduce. Now we get male we now 842, and the woman then 761 currently. Also, we don't get 2,294 contact, meaning people that don't interact with them, confirmed cases, and then we will able line list, and 896 of them don't complete the 21 days observation period. We contact monitoring. So far, as a country, we get some small vaccine we've been kind of the country for protect the populace, especially the high risk people and contact of cases them. Among them, we don't vaccinate 23,584 across the country. currently, all we district them in the country don't get registered confirmed case. Remember, some time ago, now each district there will be the record cases there. But as I speak now, all the districts in the country in Salon, Kwenadu end up in the last one we register case, or they all don't get confirmed case. But Western area urban and rural, and they account for the highest still. Most of the cases they will get now from them to district there. If you look among what you get from data, we find out say the people that they get more infected now the age group between 24 to 36 36 years.
Okay.
Most of them now that age group them, you know. And like I said earlier, still man them more affected.
Okay.
Than woman them, yes.
The program Good Morning Salon they continue, and when they bring the program come to this Friday morning, my name is Kaifa to Conte.
And Adeyemi Jackson.
Inside the program, we still get Dr. Mustapha Jalloh and the operations lead M-pox respond at the National Public Health Agency. So Dr. Jalloh, we be they give you updates. You mentioned say Western area urban, now they record the highest number of M-pox case. Why Sudan they see other country them where the M-pox they record more of M-pox sick na the rural community them, but in case of Salon they see na the urban city the case them plenty. Why?
Thank you very much, Kaifa. I think if you say you get a record of well, maybe you are right for saying a rural setting, but you know transmission of disease a more common and densely populated area, where people interact more day by day, as compared to say sparsely populated. So we know the population, the movement of people in Sierra Leone, high day, you know. I mean, the interaction so high in Sierra Leone compared to so many other countries, especially now we urban setting. Now you go to marketplaces, universities, schools, you know. So any side people then crowded and boku. Now they expect more transmission of infection, you know. So I think that's now one of the key reasons, you know.
Okay, continue for the between the program. Inside the program, we go look at another issue. Some people in Africa don't call on government for put more strategy them in place for tap the M-pox sickness Salon. As this then say the sick bad and don't they kill people them. Then people they talk this story the democracy where them be they talk but waiting and sabi about the M-pox sick. How for prevent and self-waiting governments for do for fight against the M-pox sickness Salon. Then people they talk more to reporter Janet Massacre inside this interview.
Yeah, the sick don't kind of country very bad because they carry the city sick here, it's not easy because they carry the common people and body, they make like a cocoa, big cocoa, they make you skin all the rotting, and a sick way very bad. So like the medical side, for try for do something about this sick because this sick they kill people. I think about say the medical people for try for no waiting for do for the sick they expand. Now this will country. As many try for put things in place before the sick they spread that we country because this country is a small country. When they jam, when they go off court, they sit down and put you don't go know.
You don't concern about this M-pox 6 because the area now radio at least radio any day. They say then at the rural area when I upline. And the man way they before where they ask them, we say don't launch operation friend them all. So the defender they get the M-pox 6 and the rural area, they very treat there. And they give advice to go in at the city before avoid social distance, don't not for those people the boku don't not for shakan. You don't call and do not for a government put measure in place for where the M-pox not spread like where the Ebola big kill people there and the coronavirus.
Well, this sickness we need help from Papa government. They help we greatly because sickness we bad. So we need help. Well, what do you think about this sickness? It's bad. Now they think about right right now, but let disturb other teammates. But let them help more, let them put effort, them help the community concerned about this sickness, but let not overtake other issue then for let not disturb the community people. And that are the one tell the Papa government and the health worker.
We are the sick, the big one, let them fit, let the sick come on this country. I do have the big, me not they no more try for talk. Who's call I go make for call the government. The government make they take up bigger. Do ya let them fight the sick, affect this sick here, like on the country. The one that went in America, do ya let them fight hard for this sick here, let them pull on the country.
Okay, everybody and the trouble the M-pox. Or waiting on me, you what I tell you because let me say me you two not go able to fight this M-pox here. Because let me say the well body people there are then go able to fight this sick here. Or make overcome this country here. Because let me see the one that they come outside country there they come for who the border fight and one they can say so Narani would make get the M-pox and a salon there. Well let me see the health workers the government. So I mean now they don't know what we see now from now.
The M-pox sickness we no can in the country, especially in Sierra Leone. And then we no see. Even we say within the field as a medical. So like we can try for say if we we come together, we able work make sure that this sickness we able conquer the sickness. We only talk to them, more able come together and Papa government they will try by God the power more able work make this sickness men overcome the country.
Well na sickness we don't come in the country, they come all like crash na your body and as in they go na say in the buckle and later when it burst it go become very infected and in the transfer through sweating and motor car. So we advise some people that we this sweat need for work out with pocket hand. We make sure you can wipe your body and all lay you sweat no go jam another man's sweat, lay no infect. You can just go take the vaccine because the vaccine are free. And for some people they think like the sickness no real because some man get the rash and he thinks like nah just rash. Please we advise everybody for take nah it's sickness really. But we tell the government thank you for get the vaccine free and the medical practitioner there would tell them say like make them convince and advise people there for let them take the vaccine.
Well this sickness we need help from Papa government. They help we greatly because sickness we bad. So we need help to Papa government for help.
Now some people in Freetown be they talk to Janet Massakoy, but waiting this side and call on government for put more strategy them in place for help tap the M-pox sickness salon as this then say the sick bad and don't they kill people. And the program Good Morning Salon they continue and when they bring the program come to this Friday morning. My name na Karifa to Conte.
And Adeyemi Jackson still inside the M-pox sick, the director on health alert Victor Lansana Kuroma say government don't raise public awareness, but the M-pox sick for say people them know about the danger of the M-pox sick and how they can able for prevent them. This is one interview with the democracy who say if they talk about the government preparedness for the M-pox sick pandemic. A talk more to reporter for two Yan J. Bagba.
Alright, so we start with for know the position where the government stand in terms of preparedness towards this M-pox way on campus alone.
Okay, so really without attempting for talk on behalf of government, because we in a civil society, we know we work for partner with government and basically for support government in terms of whatever it is, like we'll talk about a pandemic in this nature, this and the M-pox, for kind of like support government, but not only supporting them, making sure that government is also held accountable for whatever it is within the do or make sure that the public get awareness about this M-pox. Government get for honest enough or tell the public the correct information and how, of course, the rules and regulations that we govern, public health regulations that we, for instance, they will talk about hand washing, sanitation, because we just see recently that the government just don't give out information to the general public. You know, this is good because the public need to be aware. We don't want for that to get in situation where happen. Remember during Ebola, people they sit down longer. You know, this thing not too high time, fever leg until the public was caught up red-handed with the disease. We don't want it that to happen. So we feel good. We government don't come out with a statement and they don't also come out with the regulations them how the public for day. So So now that kind work we do as civil society, we raise the awareness, and at the same time we also hold government accountable if they not give the correct information to the public. But also largely, if treatments then they, for instance, what the government do for make sure the public gets that treatment the right way. Those facilities that people will get access to them treatment, and are those treatments affordable? Are they free? Is it costly? The people need to get the information there, so that if I get somebody where they feel from their signs and symptoms, and they will not say, oh, I will go to a social center, now they will able to treat me or whatever it is, you know, so that the thing will go escalate. We also look at surveillance, for instance. How are they doing surveillance around for go do any contact tracing? If, for instance, somebody there where they know say they get the signs and symptoms and they don't go test that, they prove positive. How the government they send in own team to follow up on their cases, then they, you know, very, very important. I think yes, that is what we are doing as a society. We make sure that government correctly do what the public supposed to know about the M-pox.
All right, you talk about the awareness one and always so far. In what form when I don't do this awareness? Like when they go house to house, area to area, and do that kind of awareness there.
So usually, if you know, say we as partners, we know the lead. Government and they always lead, we follow. Now we don't want, because then they must have savvy people there. Now that government don't already come out with a statement and they don't come out with a public message, we will support government for disseminate that message there. We they print out their information and share to we networks them. You know, head to that, we get networks there right across the country. We they lead the information then we don't do door-to-door sensitization, but we can use the media like what they do so now with 98.1. Share the information, go to the radio, go to television, make sure that the public understands exactly about this disease, right? That it has now been declared as a pandemic. People get to be aware. Let me go back to hand washing. Let the facilities there, who say public then together. Let them make sure they get hand sanitizers there. Hand washing, so they expect public places there. Banks, hospitals, pharmacies, any time we public together, let them make sure they provide everything. I think that information they really do, and that kind of sensitization they will do.
Alright, so you can tell farm results, what are the rate of the confirmed case we don't get so far?
So well, without prejudice at all, another one give a data where they can say ministry and then at the master sabi people there. The information we will get that yes, we don't get over 200 confirmed cases and also death them where some they say up to 8 or 9. But like I tell you, I know one for state here, any data where in order before me now.
That not the director, El Salat Salom Victoria Sanakuroma. They talked to a reporter Fatu Yanjidi Pagba, who's a government or the raise public awareness about the M-pox sickness salon. We they come over to the studio guest when Dr. Mustapha Jalloh, when the operation lead M-pox response on the National Public Health Agency. You don't listen from both the people and also you don't listen from a civil society body. The issue of public education in this fight is very key. Once again, people they talk about government preparedness in terms of prevent the M-pox sickness for spread so. Then we look at which are the things that we government don't put in place for ensure say that prevent the M-pox sickness for spread. So in terms of facilities and all that in there.
Yeah, thank you very much, Ade, for that question here. I think this also now a very interesting one. I think people need to know. First of all, let me know say public health. What is a public health now for the public? So any action we take, we all for taken together. The big government, non-government, private. So in public health now for safety of all man. So for let that happen, like I say, we all for come together and take some responsibility. So when we get we get you know, this outbreak then declared as a public health emergency of international concern. Now last year, August, immediately we convened a meeting as an agency under the Minister of Health. We set some structures in place, preparedness structures for ensure say we prevent this virus from entering our country. You know, so since then a lot of mechanisms will create awareness, public awareness, engage. Of course, we don't the kind of radio democracy now. We don't go to other stations then. They educate the people there about M-pox before the M-pox they enter this country. Okay. Before they get to first confirmed case. Okay. So we don't do a lot, and also as a country, we also don't. At that time, we set some identified facilities, assess facilities, and ensure say if we get a case, now them for treatment, then we do conduct training for well-bodied people then for prepare themselves for in case they get confirmed case.
You just mentioned about facilities. We don't see when Ebola come, government set set up facilities then for see our best for curtail or stop the spread of Ebola. The same for Corona as well. But inside the past year, then we don't see government is struggle for set up facilities and anytime we outbreak then at the country, and the same for the M-pox sick. We see when the struggle for set up facilities and there. The question is, what did not happen with their facilities and they will government be done the set up for the previous outbreak and they will be done the happen at the country?
So again, like I said earlier, during the preparedness phase, before they get record case, we do assessment right across the country. All the hospitals and other facilities they will get for managed cases. I'm sure now treatment facility them we talk about now. Currently, as I talk to you, we don't do assessment. We don't do assessment at two major treatment facilities there. One at the police training school, PTS, remember that team of Ebola, that they manage Ebola cases there. We don't deny a 400 bed capacity. We also do identify another facility na Calabato with a 100 bed capacity. We not tap there again. We've been established another facility na Potloko. That facility also we don't go assess them for ensure say as we scale up into this response, we utilize all them facilities in there. So we did on that. So like I say, the response now. Let me remind you again. Initially, response get levels. You know, we get what we call incident management system. Now they utilize for response to any outbreak in the world, like a global standard. So initially we start level 1, the response. Couple of days ago, we don't escalate. Looking at the number of cases they get in the country now, how the thing they spread. So we don't scale up. We don't scale up. We structures them across the country. So now we don't go to level 2 of response, meaning we don't intensify all the activities them, you know, in terms of looking for cases in surveillance, how they manage cases them. We don't draw more personnel, you know, well-bodied people them for come into the response. So that is why we don't identify some of them facility there for the whole and treat cases in the country.
So currently, we sound they treat people that will get the M-pox sick.
Like we normally say, within Freetown now we get 4 treatment facilities. Them one the police hospital, na Kinton. The other one at the 34 military hospital. We get na the Jue hospital and the Connaught hospital. These are the 4 main one. Them for the other facilities are also the whole 1 or 2 cases, and transfer them to the main treatment centers. There.
So you don't feel say this they embark in the process where people not go able again for go na them facility, then they thinking that we get M-pox patients they were already in their facility, then they so that they make them afraid for go na them different facility then they.
Yeah. So now make when you go to them facilities then they outside and they deal with M-pox cases far separated from the routine side outside people in the sick care for the day. When you visit them places, they're far apart, and the people who they work they different from the one they work on the other side. You know, so now they say we don't try for scale up for ensure say we establish more facilities in the countries.
Okay, so Doc, out of the 354 people that we say don't discharge, possibility there for say we possibly don't get the M-pox sick, you know, well, then it go get them again.
This nothing where they look into research they look into, and they say some they get infected, but in no area, not to say a common, you know. So now we very interested in the contact of cases where you don't become a case. Anybody where you feel say interact with within that period there, with the line list and monitor them for that 21 days period.
Okay, Doc, we see a few weeks back the country received vaccines then for the M-pox sick. Which is so far the happen with them vaccines in there?
When you say which in the happen with them, we received them vaccine there a couple of months ago. So as a country, in fact, we get like when the vaccine come, we get a lot of process where they go through. Therefore, we get what we call NITAG, a committee where they look at vaccine and they give recommendations how to use the vaccine at the country. They also get the regulatory body, we are the pharmacy board. Then therefore go through the safety profile of that vaccine day. So it go through all them processes and then we start. Then we launch the vaccine March 28th by the Honorable Minister of Health. So waiting the vaccine are there for globally response vaccine now for target certain individuals. We one people of they at risk, high risk people. Two, then among them now one healthcare workers there, frontline healthcare workers there, because then they serve as a shield for the population. So contact of cases. Why contact of cases? Because then if you don't vaccinate them, it will continue for spread the virus to other people then. So you need to break the chain of transmission. Right. So the thing will continue for spread. So currently we, like I said earlier, we don't vaccinate up to 23,584 people. Amongst them we get what you call key population again. Then one day now they decide and they die of this autism. So we look into data for ensuring would they vaccinate them people in there as well.
So as of now, how many vaccines will the country receive?
58,300 doses of the vaccine now don't receive.
Okay.
Doc, quick one, waiting are some of the preventive measures them of MPOX sick.
Yeah, thank you very much, Karifa. I think initially we talk about how the virus they transfer from one person to another. So the golden rule for prevent yourself na personal hygiene. Make sure say at home, at workplace, any outside where you don't interact, you don't touch surfaces, make sure you wash your hand properly with soap and water. Soap and clean water. That are the golden standard for any preventive measures. However, we could also advise people then for limit the interaction in public places, especially when you go to a place where different people in the come from different background. Make sure you limit interaction with them. One of them now for, handshake. If ever you do handshake with anybody, go wash your hand with soap and water immediately. Skin to skin interaction, you for limit as much as you can. Also make sure say as I say, you distance yourself from people them, and also I don't talk about overcrowded places then, like you go now per married or any public gathering, space yourself small with people them. Also in our workplaces, public places like market, shops them, law ensure say we maintain some of them in there, social distancing, schools as well. And very most importantly, if you see any sign or symptoms of M-pox or any body worm, anything, go immediately to the well body people and at the nearest health facility. Please, we emphasize on that. As soon as you experience any sign or symptoms of any disease so far, especially the rash, go to the nearest health facility. Also, if you see your neighbor who you sabi in your community, if you say you don't develop them signs and symptoms there, or if you say you get rash, talk to them. Not to Congosa, but talk to them and say, make you go to the hospital, let the well body people and go look them. Also, let us spread good message about we as a country. Let us spread good message about this M-pox.
Okay.
And again, like they can say, no one is safe until everyone is safe. So for now we able to stop this transmission of this virus in this country, now a whole of society responsibility at family level, at community level, and at national level. Let we all join on together for stop the transmission of this virus in this country.
Okay, so with the kind way how the case then they increase now the country, we get to expect from the ministry and the agency for think of lockdown or any restriction of movement.
Well, with data and science no guide we for do that now. So all we can tell people them seek early medical attention. Very, very important, so that the thing no go worse by you if you get them. You know, and we will continue for the educate the public on M-pox as we go along. But anything we would come and update you now on the situation. Yeah.
Okay, plenty thank you. In name now Dr. Mustapha Jalloh, and the operations lead M-pox response at the National Public Health Agency. As immediately so today for talk about the current status of M-pox sick and how for prevent. And plenty thank you. We join me at the program. Well, like this edition of the program, Good Morning Salon go left you for this week where they